In this video, I'll be demonstrating how to stretch the scalene muscles. The scalenes are a group of 3 muscles on the lateral surface of the neck, and those are anterior scalene, middle scalene, and posterior scalene, and I'll be showing you an individual stretch of all 3 of these. You would obviously stretch the scalenes if the scalenes are tight, and tight scalenes are associated with thoracic outlet syndrome and rib 1 dysfunction, particularly with the anterior and middle scalenes. Also in upper cross syndrome, chronically poor posture, stress and anxiety, and in individuals with chronic pain. To stretch any of the scalenes, the patient will be seated and the ribs must be depressed on that side. In order to depress the ribs, the patient can put the stretched side upper extremity behind the back, as you see here. Alternatively, they can also sit on their hand with the palm facing up. Either of these maneuvers depresses the scapula and the upper ribs. So because my left upper extremity is behind my back here, I'll be stretching my left scalenes. We'll begin by looking at a stretch of the left anterior scalene. To stretch the anterior scalene, we're going to position the neck in 45 degrees of contralateral rotation, add some cervical extension, and also apply some manual overpressure with the free hand. And you should feel the stretch in the anterolateral neck about right here. To stretch the left middle scalene, we'll perform contralateral or right side bending, plus manual overpressure, and ipsilateral or left cervical side glide. And you should feel this stretch on the lateral aspect of the neck. To stretch the posterior scalene, we'll perform 45 degrees of contralateral rotation, add cervical flexion, and apply manual overpressure. And you should feel this stretch on the posterolateral aspect of the neck right here. And you would hold any of these stretches 30 to 60 seconds per side. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.